The holiday season can be a stressful time of year for many, and the state of mental health in Canada is alarming. That's according to a new report from the Canadian Mental Health Association. CTV's Garrett Barry has the details.
Every Monday, Christy Allen and a group of like-minded protesters take a simple message to the Confederation Building in St. John's. Long-term mental health care needs to be more accessible.
We need so much more than talking. We need treatment. And I know that sometimes that's really complex. And the government only seems to have it figured out for simple, those short-term sessions.
For 207 weeks now, rain or shine, even on dreary November days.
All the stories I have heard from other people, it becomes personal because they share those with you, and then you take that to heart.
A new report by the Canadian Mental Health Association is adding fuel to her cause. It highlights what it calls grim realities in mental health care. Since the COVID-19 pandemic, harmful use of alcohol and drugs has risen, and patients can't get the care they need.
We know that cost is a barrier, which is part of the reason why we're arguing for better funding for mental health and to make it part of the universal system of care.
There are slight variations across the country, but on average, Canada puts around 6% of its healthcare spending into mental health initiatives. The Canadian Mental Health Association says that should be doubled, closer to the 15% that France spends or the 11% that Germany spends. If governments are not paying, then households are. And since the start of the COVID-19 pandemic, with inflation, higher food costs, and rising rent, the Canadian Mental Health Association says that has been getting harder. The group is proposing new laws to guarantee funding for mental health initiatives and a new attack on poverty to lift thousands across the country. Garrett Barry, CTV News, St. John's.